Hello, everybody, and welcome to our number 2 After Hours webinar for this year. Those of you who don't know me, my name's Kate Wylie. I'm calling in from Ghana, Yurta, which is otherwise known as Adelaide, and it's my pleasure to facilitate this event this evening. Tonight, we're going to be hearing from Dr Nina Lansbury, who I'm so pleased is here to be with us. Hello, Nina, how are you? Hello. Nina is a very esteemed person, I think. She's a IPCC lead author and has an extensive research experience with people from the Torres Strait Islands. And so she's going to share some of her vast knowledge in this area with us today. I do want to read out her actual bio because it does help understand who she is. So Dr. Lansbury has research and teaching academic is a research and teaching academic at the University of Queensland School of Public Health. Her current research examines health aspects for remote Indigenous communities on both mainland Australia and the Torres Strait in terms of housing, water and sewerage and women's health. She's investigating the impacts of climate change on human health, and this involves a role as lead author on the IPCC. Within the research sector, she was previously a senior research scientist at the CSIRO, manager of the Sustainable Water Program at the University of Queensland, and senior research consultant at the Institute for Sustainable Futures. Within the non-government sector, she was previously the director of the Climate Action Network Australia and research coordinator at the Mineral Policy Institute. So obviously she's a very well qualified person to be presenting to us tonight, and I'm so pleased that you're here, Nina. I will just acknowledge country. So the nation we are all on today, the nation called Australia, is stolen land, and First Nations people have never ceded their sovereignty of their land, and respect is owed to all Aboriginal and Torres Strait Island nations and First Nations people. Hello to a group in Ghana is Namani, so Namani to you all, and thank you for taking the time. And I do think it shows respect if you can acknowledge the land that you're on in the chat. Okay, and without any further ado, though, I'd love to hand over to you, Nina. Thank you.
Thanks so much, Kate, and hello, everyone. This is an exciting... I really love talking about research and about evidence to people who are actually able to use it and take it that step forward. And I'm sitting here, well, not right now. I'm actually at home with a background to trick you that I'm in the Torres Strait. More on that later. But you know, I sit in the School of Public Health at the University of Queensland, and applied research is what it's all about. It's about making change on the ground, and the wonderful aspect that I share with all of you working in health is about prevention, that actually we want people to have the best life. Health and well-being is the outcome that we're all hoping for. Yet we're facing this huge crisis called climate change. So I'm going to run through a few different slides tonight. I was having a bit of a kind of wry laugh with Kate before this began, that she gave me a really challenging task, which was to tell you all about the latest on health impacts from climate change, and then leaving you with feeling motivated to do something for the good, for the better. So I take it and we'll see how we go. So I'm just going to start by also acknowledging I'm here on Jagera and Turrbal country, and I pay my respects to elders past, present and emerging, and welcome all Indigenous people who are in the room. And as a non-Indigenous person, I'm very aware that is not mine, and that I'm a settler colonist living and intending to continue living on other people's land, and I'm a visitor. And the image on the screen is actually the University of Queensland, is the little red dot. But the reason I love this map is because it actually puts it back into the land and the use and the story and the ownership that has never been ceded. And it reminds us that we are on other people's land. So just to set the scene, there's a few photos that I've brought. What do they all have in common? We've got a tin house, which is kind of like emergency accommodation from the Barkly region in the Northern Territory. We've got the Torres Strait, which is an image from Horn Island looking to Thursday Island and Hammond Island. We've got a woman I've worked with who's on homelands outside of Kings Canyon, Wataka, in the Northern Territory, with some water tanks. And then we got a photo taken by my daughter when she was working in a hotel on Kangaroo Island in late 2019, and that's the bushfire there. So all of those photos, it's about climate and health. Housing that's inappropriate, that can't protect us, or can't protect the inhabitants, keep them safe, keep them healthy. In the Torres Strait, there's a whole range of issues from extreme weather events to water security. This property is growing bush foods for commercial use and sales, but does not have water security until we were involved in providing water tanks, which just made that possible. For being able to live on country and have meaningful work, but also financially viable work to raise family on country as well as work there. And then bushfires, it's such a combination of a range of risks that come together and result in bushfires that have both direct impacts on health and mortality, but also indirect impacts through respiratory and cardiovascular impacts. So that's a bit of a grim setting of the scene. But something I do like to come back, and I guess this is part of trying to give agency to all of us who care about this issue and actually want to do something about it. One aspect is public health is about the causes of the causes. It's our favourite phrase in public health. We always love to go upstream to actually where is the problem, what's causing the problem. And in climate change, we call this mitigation. Of course, there's also adaptation, and that's where we have to also be aware we're living in a changing climate, and it's too late to actually just talk about mitigation and how do we stop the problem, stop the combustion of fossil fuels. We can change that, but we've got a legacy of 80 plus years in the environment. So we actually have to also look at adaptation options that are appropriate and acceptable to society. The other dimension is what is risk? And if we break it down, we can actually talk about how do we reduce or remove risk. And so the propeller diagram that came to fame in the assessment report 5 of the Intergovernmental Panel on Climate Change put together these three concepts. Or it really just, I don't think it was their independent thinking, but brought that concept together that a risk only exists depending on what is the hazard, how much are you exposed to that hazard, and how vulnerable are you to that hazard. And climate change, of course, is an ideal example that that bushfire or that heat wave or that cyclone, it is a risk, but it's a risk to a range of people and environments in different ways. And a lot of my work is in remote Indigenous communities, and that brings up geographic and health factors that often result in people being much more vulnerable in terms of access to services, emergency services, in terms of comorbidities, in terms of racial aspects of the healthcare system and history. But also exposure. So, that tin house outside of Tennant Creek, that increases exposure, whereas perhaps someone with a private rental or private ownership might have a working air conditioning system and be able to manage the number of people who live in their household, and so that brings down the exposure because you can get out of that extreme heat. The IPCC, I'm going to talk about quite a few times tonight about the latest report. And I'm talking about the middle report. There's 3 that make up the assessment report 6. Just before COP26 last year was the first one, climate science. I've been involved in the second one, which is about vulnerability and adaptation. And my role was as a lead author on the Australasia chapter, so one of the regional chapters. And then the third one is due out in about 2 weeks, and that is about mitigation and options. We can talk about renewable energy and other aspects, but that's still to come. But anyway, this image here it's taken the propeller diagram and taken it up a level, and you can see It's much more complex, this diagram, but it comes back to that same concept of risk. And how do you reduce risk? So a little bit about me. I mean, Kate gave a lovely intro. I do a range of work, all the way from being part of the IPCC and one of 700 researchers that have been working on it for 4 years for this assessment report, but also a lot of field work. There's myself on the back of the Thursday Island ferry with colleagues on a field trip late last year, talking to community and medical officers and government officials about climate change. So roughly tonight, I do want to talk, as my brief said, about the IPCC. What is it and what's it? What are the latest findings? Big picture on global impacts to health, but they're very broad, and I think the value of this presentation is to actually bring it down to different regions and different communities so that we can actually take a bit of a handle on it, and for you as practitioners facing community and very much seeing what's coming through your clinic doors is how do you respond to both what's coming through the doors, but also prevention and working with community to lower that risk. And I will give you a snapshot into remote Indigenous community health, because it really is such an important population, and yet can be very much overlooked. It's only 1/5 of the Indigenous population live in remote and very remote areas. In fact, I'm sitting here in southeast Queensland, which is the location of the largest Indigenous population in Australia. So that's sometimes the people get quite surprised by that. But it doesn't mean that remote is not important to think about. It's actually the fact that it is so far and unseen from the centres of political power, which is why we need to keep placing those stories and those voices on the agenda in front of political decision makers. And then we have the last little bit where I do want to leave you being alarmed but not disengaging. So let's hope I can take you with me all through that journey. And I'm not really keeping an eye on the chat, so Kate, I'll let you moderate that and interrupt if needs be, or just keep the questions to the end. There's your learning objectives on the screen, so range of tasks there for you to identify and recall and understand, and hopefully we will cover all of those, or at least cover them in the question and answer session. So sometimes I think when you work in a profession, you might lose sight of how the rest of society sees you, and medical doctors are so held in high esteem, and I am talking about your superpower, but I think there is value in that. I've worked on climate change for 2 decades now, and it was only in the last 5 years that I shifted my work from an environmental focus to a human health focus, and I have not had as much cut through with communication to a range of stakeholders as I have from talking about human health. And I think it's because we all have a personal connection to health. We're all the master of the expert in our own personal health. And so you, as a range of medical professionals, hold both society's high esteem, but can also talk about health and how it impacts and kind of translate this big amorphous thing called climate change into what it means in terms of humans. It's not to diminish the importance of ecosystems and other support systems that are both for us and living beings, but it's a very powerful advocacy tool. You've probably all seen these kind of statistics. This is quite a nice one, Ipsos, that had 17,000 respondents, but about 1,000 from Australia, and continuing to find that doctors are the most trusted profession in 2021. I stuck on scientist because I've got a science degree, so I thought that was pretty nice. I came in second, but and maybe as an academic teacher I'm there too, but you're up there, and I don't think you should dismiss this. This is very powerful cut through, and this, the type of groups that you can be represented by have a very powerful voice. All right, so climate change and the IPCC. As I said, there's 3 reports to each assessment report. They're undertaken about every 8 years. COVID delayed that for us. The one that I'm talking about is on the screen. It's about impacts, adaptation and vulnerability. Came out at the end of February. You can see the structure that it has. It's diverse. There's a summary for policymakers. That's the part that most people read because it's short and it's a good summary. And there's a technical summary as well. But I strongly, strongly encourage you to go into the guts of the report and actually go to the specific chapters. So the first section is around different systems, and chapter 7 is around health. Then there's regional chapters, and I was a lead author, or am a lead author, on the Australasia chapter, which is Australia and New Zealand. And then we have these cross-chapter papers, which are stories that really needed to be told that didn't quite fit neatly into the chapter structure. And then finally, a phrase that, or 2 phrases that you will learn over the next few years: sustainable development pathways and climate resilient development. They are the 2 new buzzwords about how do we actually go forward. And this is moving away from just mitigation and just adaptation, but it's all about the integration, and it's complex and it's difficult and it's all levels of society, but it's actually quite realistic talk, because it's acknowledging that one solution and one discipline and one piece of legislation is not what we need, not anymore. It's too late for that. The IPCC is a behemoth. This particular working group, which is one of 270 researchers over 4 years, I don't have the final number on the journal articles reviewed, but it was thousands, because it's not new research. It's a summary of the latest research, and it's commissioned by the member governments of the World Meteorological Organization and the UN. So it's 195 governments, including Australia. Keep that in mind. They commission the UN, and the IPCC is an arm of the UN, and it reports to the UNFCCC, which is the group that runs the COPs, the Conference of Parties, in December every year. And for those of you who write journal articles and get the chills every time you get the reviewer feedback, we had around 20,000 reviewer comments. And the talk each time, that's because we had 3 drafts and 17 chapters, and everyone can be a reviewer, although it's not blind. You can actually see who the reviewer is and who their organisation is, what country they're from, but it's not tick and flick. You can't just tick that you considered it. You actually have to either push back and explain why you're not adopting it, or make the change. So it's a very detailed piece of work, but it's very rigorous. And something I want to leave you knowing about the IPCC is the SPM, Summary for Policymakers, the short bit at the front of the mega document. It is the only process with active government input. It takes about 2 weeks to finalise and to get sign-off. So the IPCC lead authors are sitting there with government representatives, including those from Australia. They do hold the pen, but it is the most politicised piece of the report. So keep that in mind when you read it, because that's why I encourage you to go to actually what's written in the chapters, because that is the pure work by the researchers who were engaged by their governments and by the IPCC to be an author. This is just a photo of the lead authors from the chapter 11, the Australasia chapter. And the reason I put that up is the diversity that we bring. It's a regional chapter, and as you'll see if you go to it, it's all about observed impacts as well as projected impacts and adaptation options. So the diversity of disciplinary knowledge that has to be brought into that, you can see on screen a quick summary of who we all are, what we all do. It's a big task, and it's a pretty stimulating and slightly challenging collaborative process. But grateful to be a part of it. All right, second section, what's going on? What are the big messages from the assessment report 6, working group 2? So if we just focus on Australia, these are the 9 most important climate related risks that we identified, and we identified them for all statements that we made. We had to have confidence levels for them, or certainty levels, depending on whether it was quantitative or qualitative data that we were using. So you can see some that maybe you were predicting around coral reefs and biodiversity in specific ecosystems like alpine, also underwater kelp forests. So that not on the Great Barrier Reef, but still incredibly valuable and special ecosystems that are very supportive of human life and other life. Of course, sea level rise. We even just use the acronym SLR. It's so common to have to write about. Real changes into what we grow, where we grow it, how we grow it, in terms of agriculture. Heat comes up a lot, and for you as clinical practitioners, you will be seeing or have already seen the impacts of heat, and not just mortality but morbidity as well. And then we had two new ones, new in the sense that this is assessment report 6, they weren't in previous reports, and that's this kind of scary phrase, cascading, compound and aggregate impacts. And that's like the wildfires of 2019, 2020, that they weren't just a fire, but it was the heat of the fire and the speed of the fire with the wind, and the exposure of people to it, and the dryness of the environment, that all came together in this horrific way to just have such extreme impact. And the other new aspect, as you can see, is human systems that we've set up. Are they appropriate and ready for managing climate risks? I'm sitting here in southeast Queensland. We've just been through the second floods of the 1 in 100 year floods, and I've only lived here for 12 years and I've been through 2 of them. So my maths is either wrong or the projections need to be updated. But are these systems resilient? Why are people still being approved to develop on floodplains? Are human-built dams appropriate to manage large influxes of water over a short time to prevent flooding? A bit more detail about Australasia and what's projected. So if we go now to health. So what's happening in terms of health? And there's a dedicated chapter 7, and you can see it's actually a little bit of an unusual heading, health, wellbeing and the changing structure of communities. So it's trying to cover a lot of issues, but part of the communities is about migration and how climate change affects where people can live going forward. So you can see a range of issues there about people being vulnerable and where they are. What is possible for adaptation. Mental health and well-being is a big part of the conversation, and that trauma. Thinking about people in northern New South Wales who have been evacuated in the last few days for the second time in 2 weeks with impacts on their community, and what kind of trauma that brings, both direct and then long term. This is probably all familiar to you, but keep in mind when we talk about health impacts from climate change, there are those 3 types. So it's very easy to look at direct impacts because that's how direct morbidity and mortality occur, extreme weather events directly impacting you. But it's actually a bigger impact to consider the indirect health impacts. So those mediated by natural systems. So are those ecosystems supportive or undermining of our health? Waterborne diseases and the burden of those, vector-borne diseases, etc., and how thermal limits will change depending on where mosquitoes can breed and live, and which type of mosquitoes and what kind of viruses they can carry. And then the other type of indirect health impact, which is all about our social systems, and that's where mental health and well-being come into it as well. And if we think about the 2019-2020 bushfires, which we do feature in our chapter with the IPCC, there were 33 deaths, which is terrible, a really high toll. But there were over 800 deaths that were indirect, and that was mostly through respiratory and cardiovascular. And then there were the thousands of presentations to ER with all sorts of respiratory and cardiovascular related issues. So not deaths, but a big toll on in terms of ill health. And when we tell the story of climate change, I think we need to tell that bigger story because it touches a larger part of the population, and also it triggers, ideally it triggers focus on how to have early warning systems, how to set up structures, both physical and knowledge structures about how people can respond and prevent those deaths and that level of morbidity. Now this little diagram, I do like it because it's trying to say the story about direct and indirect impacts in a slightly colourful way. So again, you can see those direct aspects of climate change in that circle and what that produces in terms of physical impacts, and there around that outer circle are all those different ways that human health is impacted. So it's a really nice visual as a communication tool from the CDC in the US, but it also means it gives you a real picture of just how widespread impacts from climate change are on human health. So if we just stay with the global picture, some of the highest noted observed impacts that are happening now or in the last 8 years of data collection. So respiratory comes up a lot, and heat, but also food insecurity. And this image behind me of the Torres Strait, they're very reliant on supplies that come by barge. The barge is diesel powered. In extreme weather events during monsoon season in summer, the barge can't always get through. That delays supplies. People aren't in general growing their own food for a whole variety of reasons that are mostly about social systems and welfare and a whole range of social issues, and yet and that actually results in making a much more vulnerable system in terms of food insecurity, but appropriate nutrition and food choices, etc. And going forward, so projections, again, heat, and that's when we start thinking also about different infectious diseases, food, water, and vector-borne, and sorry, I should say threats to mental health and well-being. But of course, vulnerabilities differ, and that's the challenge of presenting on such a document that has had to draw together so much material, is that we really risk in our communication of talking in these big broad statements rather than being able to say more specific comments about certain populations in certain geographical areas. This is pretty sobering. There are very few examples of beneficial outcomes from climate change at any scale. Really only one of them that we could pull out for the Australian chapter was that there are likely to be warmer winters, and that may mean lower influenza impact in terms of mortality in particular, which is a great thing considering the toll that influenza takes, but it's not really outbalancing all the risks that exist. So there's another pretty sobering statement. The cumulative scientific evidence, climate change is a threat to human well-being and the health of the planet. And we could have a whole other discussion, very appropriate, about planetary health, which is a higher level than just climate change. But I'll just throw that phrase in there and you can look at it yourself elsewhere. And every region of the world is affected. There's heat again, but also extreme weather events, and also that flow-on effect from extreme weather events to health services and disaster relief services. And where do we live, and how are those systems supported, such as the reliance in urban areas on transport systems and water and power, and how resilient we are, or how vulnerable we are when those systems go down. But of course, we need to then look at climate adaptation, and that's where this phrase climate resilient development comes in, this complexity of decision making and solutions that have to really think about a whole range of aspects. And there's just a few on the screen: food security, nutrition, health and well-being. All right, so now we take that big picture to Australia, but also Australia is so enormous and so geographically diverse and then culturally diverse. But the range of that we've got up, again, there's heat, it's leading the way. Um, and with those flow-on effects to mental well-being. The bushfire statistics on the screen, changing thermal limits of mosquitoes, Ross River fever and dengue being two that are really climate sensitive. How water supplies will change depending on where your water is and what the storage is like. Is it underground? Are you joining from Perth, where it's underground aquifers that are more protected from heat and evapotranspiration, or are you relying on large areas that are exposed as surface water, and what, as that water heats, what kind of contaminants might occur? Unusual things that are starting to be documented, that such as thunderstorm asthma. And then how does the health system actually respond? Even to the point of, is ER set up so that it can take large amounts of populations during heat waves? Can the air conditioning system of the local hospital even withstand the extreme heat over several days? And then we have this phrase that I did bring up earlier, cascading and compound events. So it's not just one happening by itself, but it's when the events come together, such as the 2019-2020 bushfires. Extreme heat, very dry, fire-ready material, and the wind direction. So all kind of coming together, and a large population being on the coast in that time. So unfortunately, it is complex. It doesn't mean it's not able to be addressed. It just means we have to think in a very integrative way that brings all the right people and all the right services into the conversation. So I'm now going to go to a quick snapshot of remote communities, and I haven't looked at where you're all located around Australia, but I think it is really important that we tell the story of peoples whose voices are not being heard by decision makers. It was very pertinent. So this is the Thursday Island ferry, which is actually much more robust than it looks in the photo, but there's a big storm behind it when I took this photo. And that's a paper written with two of my Torres Strait Islander public health colleagues about climate sensitive diseases in the Torres Strait. But just as a short story is when we sat together in the IPCC for the Australasia chapter, our first meeting, talked about, well, where are there areas that need to be documented in terms of current impacts of climate change. And the Torres Strait often comes up in those conversations, but when you go to the classic archives in terms of where do researchers go for peer-reviewed, rigorous, defensible data, these kind of stories are not necessarily being told. And if they're not in that archive, they cannot be cited. And if they cannot be cited, they cannot be placed before the decision makers in the summary for policy makers. And therefore, that whole population, that whole region can be overlooked. So we did proactively encourage new research to be conducted and published in time for the IPCC publication schedule, which we felt really enabled us to tell the full story of where different people were being impacted. And so if I just go to that's the motivation on why we undertook additional research. So this is myself and my research team here at University of Queensland, and also remembering to undertake research that is Indigenous led and Indigenous involved, and so the appropriate voices are telling the stories. There are places and appropriateness for non-Indigenous people to be involved, but always with those two ears open and listening and being guided. So this is one piece of work with Larrakia woman Lucy Crosby, looking at a range of remote communities and what are all those different direct and indirect impacts that are being experienced, and just pulling out one quote is just about that particular vulnerability of residents in remote communities being much higher than those in urban areas, or even those who are non-Indigenous peoples. And so the need for prevention is much higher. Another piece of work was around climate sensitive diseases in the Torres Strait. And we used a range of methods to identify what doesn't have a vaccine and has a really high mortality or morbidity load. A few different criteria we used, and we identified 5 diseases, which you can see on screen. 2 that are mosquito-borne, Ross River virus and dengue. 2 that are soil-related, melioidosis and non-tuberculous mycobacteria, and 1 that's airborne with TB. And you can see there the disproportionate burden of disease. 20.4% of cases of melioidosis in Queensland were in the Torres Strait, and yet they have 0.52% of the population. There are other reasons for it, because it is much more tropical than, say, here in Brisbane, where it's subtropical, but it's also about the story of comorbidities and vulnerabilities and access to healthcare and other issues that people may be dealing with that mean that they don't necessarily present with infections as early as other people that do not live and manage with those comorbidities. So there's huge implications for public health and prevention, but also, putting it on the radar of professionals like yourselves who may start seeing infections that you haven't previously seen in your jurisdiction. Put this all into perspective, thinking about heat and how it's going to change. So those of you who have travelled in the Northern Territory, the number of very hot days is actually a scientific indicator. It's not just qualitative. So days are over 40 degrees, currently 7 approximately per year in Katherine, and under certain scenarios will be 43, over 40, and in Alice Springs going from 14 to 48. And if you think about those days when you've been over 40 degrees and in settings that you cannot keep cool, or you have a young baby or an elderly neighbour or parent, they are really worrying scenarios. And then you think about what kind of structures do we have to keep ourselves safe and cool, and it becomes quite a health risk when you start doing that in your mind. And then more structures, human created structures, for those living in remote areas who are Aboriginal and Torres Strait Islanders, but more in Aboriginal communities. There are energy power cards that are prepaid, and while there may be some socially supportive theory behind those power cards, when those power cards run out, you cannot just use a credit card, and you can't use your basics card to refill them. You have to go to the shop, which might be a few kilometres away. It's a really hot day. So the result is, from this piece by Tom Longdon and Simon Quilty, looking at 91% of households in remote NT experience a disconnection in a year. Really high amounts. I would say if we took a poll of the attendees tonight of when did you last get disconnected, not by not paying a bill and not by a blackout, but just because your system broke down, or you couldn't prepay it. And probably none of us are prepaying, and none of us have had a disconnection. So there are inequities that exist, and there are human structures that overlay on this hardship, on this existing vulnerability. So look, a summary of the range of health impacts in remote communities. There's spiritual and cultural aspects, as well as those physical indirect and direct health impacts. So the vector-borne and the hygiene-related issues of food security and nutrition, but also caring for country. If you are culturally connected to your country, and that land is like your mother or your parents, and you have responsibilities to that country, but that country is being damaged, or you cannot access that country because you're not able to, for different weather-related reasons, that also has an impact on your social and emotional well-being. So we've also got to think differently when we consider health impacts of climate change, depending on cultural and spiritual beliefs that are held by a whole range of our population. And remembering, whose voices are we listening to? This piece of work, brilliant piece of work, came together incredibly quickly last year, led by Veronica Matthews at Sydney University and Amber Rose Atkinson, who's one of my PhD students. Veronica's a Kwandumuka woman, Amber Rose is a Gumbaynggirr woman, brilliant scholars looking at climate change. And you can see they have brought together a range of research on Indigenous peoples and how they'll be impacted by climate change. And they've brought in historical injustices, and they've brought in connection to country. And they will, the head of the Lowitch Institute for Health, Janine Mohammed, she launched this at COP26 at a side event in Glasgow last year. So, kudos to the Lowitch Institute for commissioning this research and actually having the appropriate voices and the right launching the visibility of their report. So encourage you to access that report. Another aspect when you think about remote areas is actually hearing from the people who live there. And there's some really nice piece, a kind of multimedia piece from The Guardian talking about Tennant Creek and with traditional elders, talking about when they were growing up and what they've seen, the changes that they've seen over their lifetime. Another piece from Norman Frank Japarula, who's a traditional owner he's a Warramungu man from around Tennant Creek. And actually with Simon Quilty, who's a general physician in Alice Springs, looking at the different perspectives on climate change and knowledge and systems that support them. And some women I work with from the National Aboriginal and Torres Strait Islander Women's Alliance, Sandra Creamer and Wendy Anders, brought together the voices of women living on small homelands on Aranda country outside of Alice Springs, and looking at their water security issues and energy security issues that they face. So really important that we hear actually from people who are living in these incredibly challenging environments for their health. And not too far from the end now is also something that's gaining traction, that it shouldn't be 2022 that when we're saying this is a new development, but unfortunately it is, that Indigenous knowledges for so long have been placed in a different category and really judged to be not comparable or worthy of standing beside Western science. So when we look for evidence of climate change and we look for ways of adapting, there's so much that generations have lived through, but they've passed this knowledge down in other ways that are not necessarily journal articles, and it's through oral storytelling and stories of the landscape. And for the first time, the IPCC has included Indigenous knowledges in Working Group 2, and I was really excited to be part of a small piece, but an important piece in the Working Group 2 report, and really appreciating that knowledge in its own right, and understanding there are different knowledge systems. And the nice quote from Tyson Yunker Porter's book about a really in-depth seeking of Indigenous knowledges, and hearing the voices from the communities and the knowledge holders themselves. And there's a piece written with three of the contributing authors to the IPCC who are Indigenous, Sandra Creamer, Brad Mulgridge and Vanita Mosby, who contributed but were not lead authors, and so there's a power difference in whose voices are being heard. We brought in Brad, he's a Kamilaroi man, Sandra is a Wanyi Kalkadoon woman, and Vanita Mosby is from the Meriam Nation up in the Torres Strait. And it was incredible having them involved, but they were not appointed as lead authors, and so the way that the chapter was constructed and the other chapters lost the benefit of having lead authors who are Indigenous. And so, even though the report is important and great to be published, did it have the right people authoring it and guiding that information? All right, this is the happy bit where I say, given all that, don't disengage. Hey, be hopeful. And also take action. And it's 5 easy ways. Well, not easy, but 5 ways. Okay, the first thing is, don't buy into the fact that it's a two-sided story and that stories are balanced because there's two sides that are equal. Don't let the vested interests frame the climate discussion because it's not an equal two-sided debate. Here, the 2022 IPCC report is high confidence that there are irreversible impacts as natural and human systems are pushed beyond their ability to act. Talk to the evidence. The evidence has been gathered for you. The evidence was actually gathered for the governments who commissioned it, including the Australian government. So use the evidence. Secondly, COVID has been horrific to our lives. However, we have shown that us as a society, global and national and state, can react incredibly quickly, can have whole of government responses, can have targeted funding, can do really amazing intervention that can protect the health of the population and can bring the community along with it, majority of community. There are so many parallels to swift climate action that have been modelled in the COVID response. Talk where you're offered to talk, to hear your voice, where that megaphone is. When there are conversations about sustainable development goals, the government is all ears because they're trying to achieve them by 2030, and one of them is about health. But actually, 50 of the indicators all talk about health. So it's a really open moment for climate change and for medical aspects to be raised. Right together as a block. Here's a medically related statement from the AMA about climate emergency. When doctors come together and have a combined voice on a topic that, you bring all that rigor and all that status and make a statement as clear as this, that is powerful, powerful messaging. Climate change responses, swift adaptation can be fantastic for all those reasons on the screen. And the health benefits, we call them health co-benefits, are immediate usually. Professor Christy Ebi, who writes a lot about co-benefits, that the quicker we reduce our emissions, the faster we're going to start seeing benefits for our health. It's a good news story. Everybody is a winner. And finally, going back to your superpower, you're the most trusted profession. So you've got a platform that already exists because you've earned it. And that means that you can draw from that same status and that same rigor through which you consider evidence and through which you give your advice. And if you've got the right evidence in front of you to speak from, then your voice is heard much louder than many others. So there's a photo of me with my collaborators, Francis Nono, Andrew Redmond, and others on the boat to the tip of Cape York at Sacia. I would love to stay in touch. There's my contact details on screen, and happy to take questions with the little bit of time we've got left.
Oh, thank you, Nina. That was just fabulous. And what an inspiring speaker you are. And, thank you so much for leaving with the doctors as trusted voices concept. And, I was really struck when you were talking about, the IPCC, reports, it is big, broad communication that often we have to do because we're talking about this whole world stuff, and it's hard to kind of drill down into the nitty gritty sometimes in our conversations because we're trying to get so much out there. But I think doctors could be a really good conduit for that because we can make it personal to our own patients, to our own groups that we meet, and maybe help translate some of the science to people because it's, I think, the IPCC report's a big read for most of us, Yeah. So I really, really wanted to take that up. And the other thing I have to say, I did not really appreciate that, something has to be researched for it to get in the report, like that you're responding to research. And so, by you researching stuff in the Torres Strait and then including some of the sort of First Nations things in there is how it kind of gets in. And that makes it really important to be, getting those voices that aren't being heard out there. I thought that was, I hadn't appreciated that before. Yeah, I didn't know that. Yeah. Um, I'm wondering if anybody has any questions they'd like to ask Nina, or just discussions, because obviously it was yeah, pretty impressive stuff. We might all be a bit bamboozled, Nina. um, okay, I've got some excellent summary things here. Yes. I think, could we maybe just talk a little bit about climate as a risk multiplier then? Because, I think one of the things that you touched on a lot was how, there will be a disaster that happens, like we all expect heat waves. But if there's also a heat wave and then there's a fire and then there's a blackout, then, what does that mean? Yeah. I'd just be interested in your comments on that.
Yeah, and even the way we have disaster response services, and I've sat in consultations on climate change where departments of emergency services say we actually want to be working all year round. We want to be funded all year round. We actually don't want to go to the disasters. We want to, think about that propeller diagram. It's about, yes, the risk can exist, but there are the three different ways we can manage risk. And there's uplifting information too, so that those of you based in Victoria, the 2009 and the 2014 heat waves, both very similar events, and yet both mortality and morbidity toll was lower in the later heat wave, and in part that's because there was a response by state government. There was an early warning system created. There was information given to people about how you manage yourself on extreme heat. The information came a few days earlier, warning people, okay, and there was an climate adaptation plan that was developed. So, go to the movies, go to the shopping centre if you don't have air condition. Ensure you sit with your feet in water and a wet towel around your neck. Don't go to work, get yourself cool, or go to work because it is cool. So really think through and make sure you've got your medications sorted out. All sorts of ways that we have to adapt. And to go a little bit off track in terms of outside of evidence, I'm here just out the other side of the floods in southeast Queensland, and the conversation that happened in 2011 from those affected by the floods, it was trauma. It was devastation and shock. And how could this happen? It wasn't supposed to happen. And now, the bottom of my house flooded. Well, not mine, but, lots of friends. The same people were having much more resilient sounding conversations in these floods because they were prepared. So some people had raised their houses. They'd created spaces that could flood. Yes. They had warnings so that they could put the washing machine that's often downstairs in a Queenslander, you could bring it upstairs, or you just were prepared that was the cost of the flood, and that was not so bad because all the photographs were in a dry space. And people talking about, well, we had, it was clean water, not muddy water, and the way the community came together to respond and assist. So there's both resilience of services, and there's also expectations of humans, and rather than the shock that how could this happen, but okay, this is what happens. We live in Brisbane and it floods every few years.
So it's that sense of, you have to acknowledge it. Like you were talking about, you didn't know your maths because it was the second, 100-year storm or 100-year flood. That what if we are acknowledging, then we can prepare. But if we don't acknowledge, we don't prepare, and we desperately need to be preparing. It's and I think that's what we need. There is a question in the chat about more about the floods and linking the current floods to climate change. And I think this is sort of comes to a hard question that we all have when, how do you link the one event to climate when we know it's climate, but someone says, oh, but there's always been floods. Have you got any ideas around that, or any sentences that you've used in your time about that? Because I find this hard.
Yeah, and I guess this is where a group such as Doctors for the Environment is so powerful, because you're bringing together multiple voices,
Mm.
and we're wearing hats. This is let's be honest, we are all playing different roles in life, and we have different cut through depending on the qualifications we bring and the work role that we have, and uh, and that can be very powerful if you've got, you've got the status. Why not use it? And when you have that collective voice, and so something very close to the heart of Doctors for the Environment is, in late 2019 there was a statement from 23 doctors who all work on in the Torres Strait and the Cape, which was a call for the region to be termed as a climate emergency. And the
Yes.
fact that if that was a statement that came from community groups or from environment groups, it would be received in a different way. These are government appointed doctors taking that
Mm.
next step, which, there's certain things you can and can't say depending on who your employer is and what you put in the media, but to be kind of pushed to that statement, that looking at what their patients were suffering and projected impacts, caused that call to action. That's quite a radical move, and very powerful.
I agree. And yeah, I love it when you hear people doing that. It's always so inspiring, isn't it? I think when people put themselves forward and you think, okay, go that human, and when you see other people do it, it makes it more accessible for you to do it too. And that's part of the beauty of collective action, and we all become our ripples in the pond and, create change collectively. I've got one more question that I'd like to ask you to respond to. And it's from Nick. Hi, Nick. Further to the 5 steps that we can all take, we know that the time to act is now. Given that we are on the cusp of a federal election, could you please elaborate on your call to action for all of us on what to do and say between now and then? And she's got hashtag climate emergency, hashtag climate crisis, and hashtag action now. So
Yeah, so
that's where,
so like going back to what hats we're wearing, and how IPCC what we're allowed to say, and where the boundaries are that we're not allowed to cross. That is really, that's I'm here to share what is in the report and do a bit of knowledge translation of this, enormous report, and to suggest to where you go to look and find the evidence. But as to shaping messages for political engagement, that is where I have to stop as an IPCC author. I can
yeah.
talk more as a public health academic. There's a bit more freedom there, but I guess, I'll go back to that statement that when I worked, in environmental issues around climate change and around energy types, I did not get the cut through that I get talking about human health, and I think it's just so powerful. And I'm not sure if that's the Nick from Cairns, who we spoke together at a government briefing the other day, and she talked about who she was seeing coming through the door. And while that might not be unusual for you to talk about, for those of you who are GPs or working in a public hospital, it's intriguing for those of us who are non-medical, and we don't see that. And
Yeah.
they're the stories we take home. So the more you can tell the stories of what you're seeing, your evidence, of course, managing confidentiality, but what are you seeing that you haven't seen before? What are you concerned about?
Yeah, and climate change, that sort of really important article in 2009 from the Lancet, it's the greatest health problem of the 21st century. And so we're allowed to talk about it. We talk about all other health problems, and yet sometimes we've got this reticence to speak about climate. But who else is going to talk about the health effects of climate change if health professionals don't talk about it? And so, it's kind of our bag. It's like it's our responsibility, I think, and our opportunity. Um, I will just do a quick plug to finish the event tonight. This will be the last after hours until after the election, which is due in mid-May. And between now and then, Doctors for the Environment is running 5 Meet the Nominee forums in 5 states across the country. The first one is in Boothby, which is and that's in 2 weeks from now, on April the 13th, where the 4 candidates from Boothby, so the Liberal candidate, the Labor candidate, an independent candidate and a Greens candidate will be joining with me, and we'll be asking questions about climate change and human health. And you can all listen and make your decisions accordingly. All right. Look, thank you so much, Nina. Thank you very much for taking the time to talk with us tonight. And I've also put a link in there to the feedback form if people would like to fill that out. If you're a GP and you want points for that, you do need to do it to get them. But I'm always happy to have feedback on these events. And I think we should all show our appreciation to Nina for sharing her time with us and what she's taught us today.